Okay, and I will hand it over to you and let you get started.
Okay, sounds great.
I'll keep an eye on the chat from here.
Okay. Good morning, everyone. It's a pleasure to share with you on patient-oriented research. I'm Christine Andrews Stobart, and I am the Training Capacity Development Director at the Saskatchewan Centre for Patient-Oriented Research, affectionately known as SCIPR. And it's a pleasure to share with you more about patient-oriented research, and I'm looking forward and hope you really engage with the presentation. Ask lots of questions, interrupt my presentation when you think I've said something interesting or perplexing or provocative. And given our numbers, let's consider this a discussion, not really a presentation. I do really welcome all your questions and comments. So on that note, I really do want to start in a good way and just share that SCIPR is a provincial support unit based on Treaty Lands 2, 4, 5, 6, 8, and 10, which are the traditional territories of the Cree, the Saulteaux, the Nakota, the Dakota, Lakota, and Dene people, and the homeland of the Métis Nation. We seek, as a support unit, to reaffirm and strengthen our relationship with Indigenous peoples of this land through the work that we do, especially patient-oriented research that we support. So what are we going to cover today? We're going to do a little bit overview of who SCIPR is. That, again, is the Saskatchewan Centre for Patient-Oriented Research. We're going to look at what patient-oriented research actually is. We're going to talk about who is a patient. We're going to talk about two tools that we use extensively when we look at patient-oriented research. And then probably the part that really is going to interest you is how you can get involved in patient-oriented research as an undergrad. And one of those ways is with something called the Health Education and Research Training Project, and that is known as HEART. And one of the things that I'm so pleased to have today is a co-presenter, and Cassidy, who's in the HEART program, will also be sharing with us later on about his experience as an undergrad in that program. And certainly there'll be a question and answer time at the end, and then some closing comments. But again, if you have things that pop, if you want to type in the chat and just ask questions as we go along, we have somebody monitoring the chat, and you can certainly do that as well. So a little bit about SCIPR. So the Canadian Institute of Health Research is a big overarching health research body in Canada. And about 15 years ago, it launched a program to, I would say, democratize healthcare in Canada by listening to patients. And the best way, and their intention was really lofty, but they wanted to combine the voice of the patient with good science. And in that way, they wanted to engage patients in actual research projects. So CHR launched the strategy for patient-oriented research, and that's called SPORE. They set up SPORE networks, which are national programs of research on particular topic areas, like chronic kidney disease and youth mental health and chronic pain. And these research networks are across the country, and they support patient-oriented research projects which contribute to a national healthcare agenda. But they also established little provincial units, and those are called support units, and they support patient-oriented research on a regional level, but with federal dollars. And the acronym stands for, the support units are support for people and patient-oriented research and trials. And the objectives of this group are to identify and address patient and knowledge users' needs, to provide specialized and multidisciplinary methodological expertise in patient-oriented research, to assist decision makers and investigators to identify and design studies, advance methods and training, and provide timely access to data. So huge, huge mandate. And that's what Skipper has been set out to do. We've had 2 iterations of our grant. We had Skipper 1.0, 2.0, and we're really looking forward to 3.0 in the very near future. So we've been at it for about 10 years, and we're hoping for another 5. We can't do this by ourselves, and one of the reasons is that all the dollars that we receive have to be matched by a partner organization. So somebody in the province of Saskatchewan has to step up and say, we'll support this too. And it is a small change. So the first grant was about $64 million, and the second one was well over 30. And so our partners, and I need to acknowledge them, are this is SHRF, which is the Saskatchewan Health Research Foundation, Health Quality Council, the Saskatchewan Cancer Agency, eHealth, Health Authority, USask, SaskPoly, First Nations University, and U of R. And I just want to, I also want to acknowledge that we work really closely with Métis Nation Saskatchewan and also the Federation of Sovereign Indigenous Nations, which is known as FSIN. And also we work with the government of Saskatchewan in 2 ministries. One is in health and one's in advanced education. And of course, we work closely with patients. And that is where I want to start right now. Who is a patient? And I think we have to be really mindful that this is a word that is very broad in our work, and that is that the patient isn't always the person who has experienced a specific healthy issue, and they're definitely not just people who are in hospital beds. The patient can be someone with lived experience, and we're going to hear that word a lot, lived experience that may be personal, but I also can include the experience of caregivers, family members, support groups, and in the case of Indigenous health, a community. So when we look at patients, they can be current and former patients. So yes, people who've had a healthcare experience, and most all of us could be patients because we all had a healthcare experience, I would assume. It could be caregivers. So when we think about somebody, for example, who has dementia, they might not be able to contribute to a health research project, but the people who care for them, maybe a spouse or a family member, can. We talk about support groups. So we have research that comes from groups. For example, we have long COVID research and a long COVID support group who had people who had long COVID were very instrumental in helping us with our research. We can have community groups like the Alzheimer's Society or Heart and Stroke Foundation because they represent patients as well. We can have family members. So we have lots of people who come to us and we have a whole pediatrics arm where we have people who actually have children who have healthcare concerns. It could be seniors, it could be any family member who is intimately involved with someone with a healthcare issue. And then really it's the public too, because these are all public dollars that are being spent on this. So how does patient-oriented research actually differ from traditional research? And so if you've done any courses in research, you've probably seen it from a very traditional point of view. And that's where there's a principal investigator. We often call them the PI, and they sort of lead the charge. They're the people who have the program of study, and they've written the grant or they've made the proposal, and they are sort of in charge of the research. And then there's usually researchers and co-investigators and co-collaborators that come along and they also help. And quite often we have trainees like grad students or postdoc fellows or even just, undergrads that help with the research. And then we might have content experts, which is a good example, would be clinicians like nurses or physicians or nutritionists or pharmacists. And then we have participants, and that includes patients in the community who provide their data. This is one of the things that we have to really draw, uh, uh, will become imperative to what the difference is between patient-oriented research and traditional research. When we look at patient-oriented research, we have that PI, so we do need a faculty member or somebody who has a background and expertise in research to actually lead the methods and methodology. We also have researchers, and that means we do have people who have a background, maybe in clinical trials, they have a background in case study. We need people who come along and help the PI. We also have trainees and grads, whether it's undergrad or graduate students who also are on the team. We have the same content experts for like clinicians and nurses and pharmacists and those folks. We have participants that we actually take data from quite often. They're people who supply us with the information. But in red, we have two other people, two other knowledge users. And one is patients as team members. So we ask patients to come on the team as actual equals to the researchers because they're going to provide their information, their lived experience as to how the research unfolds. So a really good example of that is Cassidy is in a program right now where we're looking at palliative care, right? Or actually you're in the bridge program.
Yeah.
And I'll get you to talk about that later, but I'll use the palliative care one as an example right now. And we're looking at palliative care, some metrics are sort of an evaluation of how it's unfolding in two places, St. Paul's Hospital and Glengardia, a hospice. And our students had the privilege of listening to two people who have lived experience with palliative care. And one, I was hoping she could be here today, is a woman who has had both her mother-in-law and her mother have been in palliative care. So she shared her experiences. And then we have a gentleman who's actually a prof in vet med who had a very close friend pass away. And then very shortly after that had a family member pass away. And so we have them share their experience with the students who are also doing the interviewing, right? And so we had them as interviewees sit down with our students and practice interviewing. And because they have lived experience and because they are speaking from a space that is very very close and dear to their heart, we have really good engagement, right? And we have students who learn a lot from these people. So patient partners, they're providing us with feedback on our interview questions, on our survey questions. There are people who say, you know, this is how you can find your participants, or I know somebody who you need to talk to, right? They're also the people, and we're going to find out who actually help disseminate the information that we gather, right? They become partly advocates and partly knowledge translators themselves. So those two groups of people are really, that group of people is really important. And along with that, we also want decision makers. And that is people who are in the system who can change practice. And that means we have to have like somebody from the health authority, or we have to have somebody who's in a role to change policy. A good example is so at palliative care, we have a director involved, and we also have administration involved from Glengardia. So we are hopeful that between the lived experience of our patients and also the health system and decision makers on the team, we can actually change how we do healthcare and make it better. Oops. I don't know why that's showing twice. So patient partners, and I was just sort of describing that, how can they be engaged? They can be engaged as a member of governance committees and councils. And so we do have people who sit on the skipper board, right? Who are patient partners and inform actually the work that we do. we can have them as active members of the research team. And there's the research cycle that you see. And we know that, like, for example, our patient partners are helping us right now with preparation for execution of the study. So they're helping us prepare questions, teaching students how to interview. And once we collect that data, they'll also review it before once the students have analyzed and interpreted, they'll also go over that. And they'll also help with dissemination. And one of the things we get excited about is that they're usually highly supportive of ensuring that our students have a very positive experience actually reporting on this to SHA. The other thing that patients help in training and knowledge translation and mobilization, a lot of them will teach courses with us. And like I said, it was too bad that Deb couldn't be here today because it's nice to have her voice here too. And they'll also be the people who help mobilize some of the knowledge going into the system. They're the people who go out and advocate and ask. For example, when we talk about palliative care, we know that there's only one palliative care facility other than the hospital here, right? And there is a need for more, right? So we're going, you trust that your knowledge users, especially your patient partners, will go out and advocate, whether it's in the community or with government, for more facilities like that. Once we have an evaluation that shows that they're, and maybe I'm jumping to conclusions here, but that they're well utilized and well needed. And the last thing is in the evaluation of patient engagement and poor. And so our patients, if you're a trainee, a good example is Cassidy again. When he submitted his application, right, our patient partners would have gone through it and looked at it and said, is this meaningful patient engagement? And one of the things is that we have a tool for that, and we'll share that in a little while. But they're very actively engaged in improving the research that goes forward. So on that note, I just want to share a little bit about those tools. So patient-oriented research tools that we have, we really look at some of, it's a validated tool, and because it's validated, we have some clout. And one of the ways that we ensured that happened is that some of the criteria that we've used is actually from CHR themselves. So CHR's definition is patient-oriented research refers to a continuum of research that engages patients, partners, in bold, focuses on patient-identified priorities, and improves patient outcomes. This research, conducted by multidisciplinary teams in partnership with relevant stakeholders, aims to apply the knowledge generated to improve healthcare systems and practices. So, along with patient partners who were actually really, at one point in time, in the very early stages, they were reviewing applications. They said, you know what, we need something standardized here. Like, we're just kind of guessing at what good patient-oriented research is. So they helped us to come up with this tool, which is a tool that actually measures, evaluates how meaningfully patients are engaged. And if we go back one slide, if you look, there's two axes, and the other one we used a very powerful scale. It's the International Association for Public Participation scale, and the verbs inform, consult, involve, collaborate, and empower are really important when we consider how we engage patient partners. One of the things that we really want to ensure is that they're meaningfully engaged and they're not just tokenized. They're just not people who sit on there and we check off a box. We want to make sure that they actually have a voice. And in order to do that, we want to make sure that that they actually aren't just told. So that would be kind of inform. That sometimes we can only consult with patient partners because if we're doing bench research, that's sort of where we're at. We ask that they, we look forward to them to be involved directly, sharing their viewpoints and their understanding. We talk about collaborating with patient partners in all aspects of the research project, and that's golden. That's where we hope everyone sort of aims for, is that piece. And then empowered to place the final decision-making in the hands of the patients themselves. That is a very lofty goal. And sometimes not all that possible given the fact that we still have to have academics who are directing us when it comes to some of the methodology and methods that we use. And also hold funds. So again, that is the Porlet tool. And so if you look across, you can see that on the horizontal, we have informed, consulted, involved, collaborate, and empowered. And on the vertical axis, we have patients as partners, patients identified priorities, outcomes important to patients, aims to, integrate knowledge to practice, and then teams are multidisciplinary. And that again is ensuring that we have some breadth to our research. It isn't just one physician and we haven't consulted some of the other knowledge users who might be nurses or pharmacists and nutritionists. The other thing that we've also created, and I think this has become more and more relevant and something that we really encourage, is that if you're engaging with an Indigenous community, the terms of engagement and what meaningful engagement is different than if you're just in with academic, not academic, with a regular team of sort of traditional non-Indigenous participants and patient partners. And so this tool, created by our Indigenous platform and our Indigenous Health Advisory Council, shares what it looks like to meaningfully engage with community. And then the last bar is the last line row is about how to keep it patient oriented. So we want community engaged, but we also want individuals with a lived experience, right? So if we're looking at, for example, Indigenous birthing practices, we want to ensure not only is the community involved, but women who've actually are interested or have birth babies, right? So we still need people with lived experience who can speak to the topic. So this is a tool that we use when we work with Indigenous communities. On that note, we provide a lot of support with people who are doing Indigenous research, healthcare research, and we provide a building research relationships in community modules and course. And we do that with First Nations University. And we also have one which is for Indigenous communities, and it's realizing their rights and responsibilities. And we go out to community and help them understand exactly what their rights are as people who are engaging a researcher in academic research. So why is it important to have patients engaged? Because patients are experts in their experience and process knowledge gained through living with a condition or illness. We see that time and time again. You'll see how researchers might have one question or one way of doing things, and then a patient comes along, hey, that's not going to work. And a really good example is one research project that we supported. It's through nursing, sensational project. And it was a woman, a nurse who was living in rural community. And she realized that there was a lot of distress and emotional and mental health issues with farmers, right? And agricultural workers. But they were very reluctant to share that because the culture doesn't allow for that, right? There's a certain taboo to sharing that kind of information. But she recognized it and she said, I'm going to do research on this. And the first thing I'm going to do is I'm going to go send out a whole bunch of surveys in the mail to farmers. And that was her approach. What happened is she got some patients, one or two patients involved, who were farmers, right? And our farm families. And they said, yeah, you're going to send those surveys out and no one's going to answer them. They might not even open it. So she said, oh, well, what would you suggest? And they said, go to auction sales, go to agribition, go to all the egg shows, set up a booth, have free coffee and donuts, hand out a ball cap, have a few bales of hay for people to sit down and talk to. And it took off like wildfire. It absolutely took off with like wildfire. And what she did is she went and people heard about her work and said, this is essential. And she actually had a farmer come out and said, you know what? I can't give you cash, but I'd love to donate a steer to an auction mart, right? And any funds that this steer garners will go directly to your research. And so this went on. So of course, this steer goes up for auction, and it goes up and up. And in the end, $15,000 was raised just because farmers were invested in it. And she went to where they were and she saw the importance. The program has mushroomed. She was able then to establish a little group of people who are on a helpline, sort of like a kids helpline, but just for farmers, completely anonymous, all registered clinical psychologists, and they all have experience and background in rural communities. Again, has just took off, right? All the phone calls were free and they were all anonymous. She had to hire more psychologists. It just grew and grew. And just as of April 1st, Ministry of Agriculture has just picked it up and will support it for the next 2 years. Plus, she has the support of Cardale. So you see how going to your patients, right, and finding what they need, and just her idea of going and meeting the people where they're at made a huge difference, right, and got the ball rolling. So that's a good example of people, our patients are experts in their lived experience. It's the most effective way to focus research practice and policy makers endeavors on what matters to patients. And that's, again, we see with this thing, right, is that when the ministry saw that this makes a big difference to their people, they got behind it. And one of the goals is for Skipper to shift that culture so that we include patient partners. So our research is all sort of embedded in what patients see as important priorities and what patients see as important outcomes. Benefits of patient-oriented research, well, involving patients in developing the research question and result in research that's more relevant to patient needs. Sometimes as research, we think we know what people want, but not necessarily. And a good example from a while ago is in Ontario, somebody was looking at dialysis. And one of the things they thought was really important is that patients would want to know how to access dialysis when they travel, right, like to other provinces. And they got a group of patients together, and patients said, that's not at all what's the priority right now. We all have a certain itching syndrome that comes from dialysis, and you need to deal with that before you tell us how and to get dialysis and other problems. And so that's what they looked at, is this huge problem that people with dialysis have with unbearable itching. Involving patients in analyzing the data, they can help with the interpretation. We see this especially with qualitative research. Involving patients in translating the knowledge from researchers and can open new avenues for education and empowering patients. And we see this, for example, we had somebody who was looking at falls and seniors, right? Well, the best thing they could do is get a whole bunch of seniors to go around and share it with all their friends and everybody, not only at coffee, but at actual little sessions, right? Oh, at this nursing home and at this long term. And that was the best dissemination of knowledge you can imagine, right? Is getting patients to do that for you. And they had a whole program for fall interventions. Now, how can you get involved in patient-oriented research? And as undergrads, it might seem like that's a little bit of a challenge, but I do have some suggestions for you. One is that Skipper has something called Pearl, and I kind of refer to it as a bit of like a dating app. And it's a platform that brings patient and health research teams together. So researchers can look for patients on the site. So if you're a patient and you are have a child who has autism, right? You might say, I'm really looking to engage in a research project about children, aged 2 to 5 with autism. And so researchers can find patient partners there. The reverse is also true. Researchers can post something out there and say, hey, I'm researching, um, uh, dementia in rural farmers, right? And you can say, oh, I'll sign up for that because I have a grandparent who is. As well, this also serves as a place where you can find participants as well. So if you're looking for people to generate data, you can also find people there. So it's a website, you go and you sign up. And every one of us has been a patient. Every one of us probably has something that we could offer system. So it's one way you can be involved is you can become a research partner or a participant as well. So Pearl is a way for you to get involved as a patient partner or as a participant. But the one that I think is really cool and I think you want to hear more about is our HEART program. And on that note, I'm going to just offer a little bit of an opening, and then we're going to turn it over to Cassidy, who's been in the HEART program in 2 capacities, not only as a student, but also as a mentor. And it again, as it says, it's undergrads. They do 2 terms on Fridays for 1.5 hours, no cost. And the curriculum, term 1, we do sort of the foundations of a learning health system and foundations of the Canadian health system, Indigenous perspectives on health equity research, and then and research literacy. And we actually provide a lot of background on patient-oriented research. And then 2 term, we actually do a research project in the community, and you actually analyze real data and you actually present to a decision maker. So take it away, Cassidy.
Thank you. So I'm Cassidy. This next term in the fall, I will be doing my final year of my psychology degree. And as Christine said, last intake of the HEART project, I was a student. So for the last year's fall and winter terms, and during the spring term now too, I am currently being a mentor with the HEART project. My notes are all over the place, so I might be a little repetitive, but so HEART really enhanced the way I view research by showing me how important community and patient partners are in research, especially in healthcare. Before HEART, I didn't know a whole lot about patient-oriented research, but I now know that it is so necessary in order to get the perspectives of everyone involved, especially Indigenous or marginalized groups who otherwise may not get the opportunity to be heard and share their opinions and experiences. I also learned that relationships and trust are so important when it comes to research, especially with Indigenous communities. I now have a deeper understanding of patient experiences in healthcare and how different those experiences can be from one person to the next, which is why it is so important to learn everyone's perspectives, because what might be a positive experience for one person could be negative for another, and negative experiences in healthcare will have a negative effect on trust and may lead people to avoid seeking care, which is exactly what we don't want. But yeah, you will learn a lot about patient-oriented research and about patient experiences and how important it is that we know and understand, or at least try to understand those experiences. Especially within the healthcare system, it's really important to capture the great diversity of perspectives and experiences in order to improve both patients and providers' experiences. Learning about other people's perspectives and experiences helps you be more reflexive and aware of your biases too, which is very important in research. Yeah, HEART's is a great project, especially if you're looking to gain some research experience. Speaking more to those in like health studies and or psychology, but anyone who will be going into the healthcare system would benefit greatly from the HEART project. Also, if you are having trouble finding a research supervisor, HEART is a great opportunity to learn more about research methods and get some practice with these methods, which may in turn help you find a research supervisor. Yeah, I learned a lot about doing research with Indigenous communities. Oh, also, if you participate in HEART project, you will have the opportunity to do additional training modules like the BRIC, building research relationships with Indigenous communities, and Indigenous research methodologies, which are normally would cost you a few $100s, but through the program, you get to do that for free. Um, and also you get to meet with patient partners and hear about their unique experiences. Um, I learned a lot about more about cultural competency, and we all gained experience analyzing data and taking that data and presenting the main findings and the importance of those findings to uh, stakeholders in healthcare. Um, which this is actually a really important skill. Like you could be the best researcher, but if you don't know how to present your findings in an effective way, you'll never get the funding for your research. Yeah, and I gained experience practicing interviews and note taking, which are essential skills in doing research in the social sciences. And I gained more experience coding and conducting thematic analysis of interview transcripts. Um, yeah, we had the opportunity to gain both practical experience with both qualitative and quantitative methods in data, which I thought was so useful and important. And the project increased my confidence and experience with necessary research skills and practices. And one of the projects we were working on, we were working with the Bridge Clinic, it's a clinic for those who don't have a family doctor and have a chronic condition. But yeah, I was able to do some of the patient interviews, which so you get some real research. You may be able to get some real research experience through Heart as well. And now as a mentor, so I'm a mentor for the spring cohort of Heart, and there's even more opportunities to learn and grow professionally. So far, it's definitely increased my confidence in research and leadership and speaking. Uh, and you'll get experience as a leader, but you also receive leadership training from Skipper as well. Plus, one of the best ways to study and learn is to teach to others. And as a mentor, you'll be helping teach the students. uh, like yesterday, we helped guide the students on how to do design a survey on SurveyMonkey and perform like rapid thematic analysis of data collected from a survey of the staff and volunteers from the Glengarda Hospice for the other project. And yeah, it's really being a mentor has really helped me step into that researcher role. And now my experience as a Skipper summer traineeship recipient. Yeah. So yeah, currently going through a student summer traineeship through Skipper. Um, and I do feel my experiences with Heart are definitely helping me out with my research. So summer traineeship is a paid position to do research over the summer. And so basically I'm getting a head start on my honors project for this traineeship. Um, so the project, we're working with Homebase. Homebase is an integrated youth service hub. There are three in Saskatchewan, Moose Jaw, Humboldt, and Sturgeon Lake. We are working with the Moose Jaw hub. Also, Homebase it's partnered with like the John Howard Society and the YMCA Regina. Um, but yeah, we're working with the Homebase or Moose Jaw Homebase hub. Homebase serves youth like 12 to 25. It has a like for youth by youth design. And so there's a youth co-design team. And the project, so there has been an increase in boys and men accessing services through Homebase. And boys and men are typically ones who do not seek services. So we want to find out why. We are currently recruiting a youth advisory group to help direct the research, analysis, and knowledge translation. And so the goal of the project is to identify those supports, processes, and resources that that assist youth in engaging with those services and in developing personal mental health. And that information will be used to further refine further refine mental health programming at other youth service hubs in Saskatchewan. Yeah, so far designed some recruitment posters and also a survey on SurveyMonkey for the youth to apply to join the youth advisory group. And actually, excitingly, we got our first response on the survey last night. So, but that's kind of all I had prepared. So,
Thank you so much, Cassidy. That's amazing. Does anybody have any questions for Cassidy about his experience as both a Hart student, but also as a Dare Summer student?
I think I love the Heart program. I think it's just such a great guided way for students to have a real research experience working with, community partners or the research you're doing has a real impact. You can see that it's connected. It's a practitioner-based kind of thing, right? So it's actually having an impact at the end, but it's this wonderful guided process. And I don't know if you can talk a little bit about that, just in terms of what's in term one and term two, and sort of how you go through a bit of learning in the first part of it, and then sort of start to practice some of those methodologies and skills, and sort of work through a research cycle as part of the Heart program.
yeah, so you start out, you learn the basics about patient-oriented research. They'll have patients come in and then share their experience, or patient partners come in and share their experiences. And yeah, we also had chances to practice interviewing, but then some of us also did get a chance to actually do interviews of patients, which I thought was great. Um, they'll they guide you through how to do thematic analysis, and then change, like, take that analyzed data and put it into a presentation, make it so that it's good, so that everybody likes the it's effective, and yeah.
Yep.
And I think one of the things that, Cassie, you had the opportunities that Brick was delivered in person. So you had somebody
Yes.
who came for 2 sessions to deliver building research with Indigenous communities. We also do a session on the learning health system. We go through what the healthcare system looks like in Canada and locally. We also do one on knowledge translation, knowledge mobilization, which is upcoming.
Mhm.
Cassidy won't be there because he's done that one already, so he will go in, and we have a very significant module in leadership, right? That addresses CHR's competencies, right? That he'll be part of that as a leader, right? So he gets to do that. And we also had, like, for example, in this last session, we had people who came from Glengardiat and the hospice and ethicists, right? We talked about that. We have a whole session on consent and confidentiality. Like, those are the kind of things that we do. I'm just sort of pulling from the top of my.
Yeah, we learn a lot about ethics and everything too. Like, you do have to have your tri-council policy statement, of course, finished before you do CART, but it's like a free online, doesn't take that long, but it's very important still.
It's just such a great hands-on approach to learning, and then applying that knowledge right all in one program. It's just such a great design.
Yeah, there's not really a project like it that I know of anyway. But yeah, it was such a good opportunity because you learn the methods, and then you have an opportunity to practice the methods, and then do be a part of the actual research involved as well.
I have a question, but it's more like from your personal motivations, like where I'm sure that Christina will get more into like how to connect with all of this.
Yeah.
But I'm curious, like from your own perspective, what made you take the first step to like, I looked at this is interesting, and this is what moves me to get involved in that.
Well, I mean, my plan is to get a PhD in clinical psychology, and once I got emailed about the opportunity to join Heart, And I thought it would be a great opportunity to gain research experience, but also because I want to go to clinical psychology, experience within healthcare, I think would be crucial for that. And I do also have interest in doing research in partnership with Indigenous communities. And so, like Christine said, we had Jed Huntley come from First Nations University of Canada, and he came and he taught us about like building research relationships with Indigenous communities and also like general history of Indigenous societies in Canada. But which is important. It's important to know the history just so you know, I guess not to like know what to do to improve things. And yeah, kind of lost my train of thought. But yeah, no, I'm really interested in working with Indigenous communities and this heart project is really great because it's yeah, you get that practical experience and sorry, I think I answered your question.
Bigger picture in your career and stuff. So
Yeah, and like, oh, there's been like a trajectory for me where so I started with the heart program, and then I applied to be a mentor and got the student summer traineeship kind of the same time. Like applied for my honors and got accepted for that, and so now it's just like everything's all falling together. But I really think that heart really helped with that, like helped form my pathway.
Do you want to stay there? I think we have some information on traineeships. There's two summer traineeships. One is OVDR, and I think we have a med student here. So just, there's summer students. We support summer students, and we also support social science students through the DARE program. And that also comes with an added advantage. Not only do you have our supports, but we also are very committed to compensating our patients for their engagement. So patient partners get engaged, and we give you extra funds to do that. So they all come with extra funds to support your engagement. Also, we do have traineeships for grad students as well. And I will also share because I see that backpack. We also have it for residents. Residents, really cool program because they get a fairly significant stipend to do it. So they get $10,000 to do patient-oriented research over a year. They have to engage patients. It's basically, I would say, QI on steroids, right? Like, so quality improvement. I was just talking to one of our ER residents who actually did a SPORE year project and just sent her manuscript for revision again, right? So, there's that possibility of also, and we're hoping Cassidy has that opportunity to get a publication out of some of this too. So anyway, so there is those programs. And then one of the things that we also have is a community practice. It's the Patient-Oriented Research Alliance, and we welcome you to connect with us. You can become a member, and we'll invite you to all our events, which includes networking events or opportunities to actually learn more about really good patient-oriented research. So I was talking about the nurse who did the Pharm-H program. She presented at that, and so then you learn all about how she did her work, and it's great. So we have at community practice, we have a learning series, we have a speaker series, and we welcome everybody to join up. And then all the resources that come with being part of that, and that includes a repository on a whole bunch of good resources and articles. I was going to say one of the other things is really cool is that the coordinator of this program, which is Carson, who is was actually a summer student and OB. She was a DARE. She was a DARE. She's now our program coordinator and working full-time while she waits to get into a master's program as well. So there is, I think, some outcomes and impact that we can see. Questions for any one of us? Well, we'd really love you to keep in touch, and this is some of the information doing that. I've gone really old school. I do have some business cards because the program for the fall hasn't been advertised yet, and we don't have dates for it. But it usually starts sort of like the second or third week of September. I think the third week of September, and goes Fridays throughout the year. But if you want a heads up when that's coming up, just take one of my cards and I'll fire you the information directly. But other than that, look at Pause. It will be out on Pause, or
Well, make sure you send that to us and we'll certainly
Yeah,
send it
yeah.
to our Sure community.
Yeah.
And make sure all those folks get a heads up on it.
and really, I don't even know if you knew this, Cassidy, but the last time we presented, we have 3 students from the last
Great.
group that actually signed up as a part of our group.
Awesome.
And there is 2 requirements. One, you have to have at least 1 research course. So typically ends up being people in their 3rd and 4th year. And you also have to do, like you said, your tri-council ethics certificate before you apply.
Which is something everybody should do anyway.
Yeah.
Yeah.
So anyways, but please take a business card if you're interested, and I will get that information to you as soon as it becomes available. But other than that,
Amazing.
I think that's all we have for you. So
Well, thank you, Christine and Cassidy, for all that awesome information today. Cassidy, thanks for sharing your experience with the program and your sort of trajectory. Like I said, we do a panel of sort of undergraduate research pathways, a panel discussion from students in the fall. So we'll do that again. I think I'll reach out to Cassidy and have him share the story there as well, if he's willing, because yeah, there's lots of different pathways to getting to where your goals are in terms of research and your academic pathways and whatever else. So yeah, keep an eye out for that. But yeah, thanks, folks. Much appreciated. Thank you.
Thank you.
That's great. Thanks, folks. We appreciate it. Coming and doing that again. That was awesome.
I didn't really look at the time, so I hope.
No, you nailed it. You nailed it.